As the country faces new challenges in this COVID-19 fight, what should we do to move forward? Let's get the views now of Dr. Benjamin Ko, Chief of the Infectious Disease Department of Pediatrics at the UST Hospital. Dr. Ko, thank you so much for joining us. We're now seeing, as reported by Caroline Bonkin, rising number of COVID infections. Are you concerned?
Oh, yes, definitely. We should all be concerned because we've just started the vaccination program now. So that means that with the rising number of cases, the tendency is you might overwhelm the healthcare system in the Philippines if this is not addressed.
And there are already reports that some Metro Manila hospitals are getting into full capacity, particularly for the ICUs. With this rise in COVID-19 infections. And they're now blaming the South Africa variant, which is more transmissible, for this rising caseload. It may be more transmissible, it may be more contagious, Dr. Ko, but is it deadlier than the original COVID-19?
Well, reports say that the surge is now driven by the new and more contagious variant. But you have to remember that the more cases there are, then the more lethal it eventually becomes, because that means that if there are more people that do get it, then the transmissibility into a vulnerable population is much higher. You know, there was a time that when with the ordinary COVID version, you could tell, because if one in the family would get infected, about 2 of you would get infected eventually. But now, if you have 5 people in the family, when one gets infected, all the 5 will probably get infected as well.
So, Doctor,
so that's how transmissible it is.
That's right. But will this rising number of infections improve vaccine confidence among our kababayans? Will more of us now want to be immunized?
Well, it is our hope that everybody should get immunized, because that is part of the solution to the problem, particularly the healthcare workers, because the surge in new cases is anticipated in the next few weeks. And the OTCA group, and I will echo them, believe that this will overwhelm the healthcare system and its workers. And that's why we are encouraging healthcare workers in the NCR and in the adjacent provinces, particularly those with very high cases, together with other frontliners, identified as priority in the national vaccination program, to get themselves immunized as soon as possible with any available vaccine procured by the government. It's either you get COVID or you get the vaccine.
And you yourself, Dr. Ko, have been vaccinated.
Oh, yeah, I got immunized already.
That's right.
Yes.
A couple of days
Last
ago
Wednesday.
with Sinovac.
Yes.
What made you decide to get immunized so soon instead of waiting for the Western vaccines to arrive?
Instead of waiting for which one?
The Western vaccines, such as AstraZeneca, which arrived yesterday. I mean, we're also expecting the likes of Pfizer, Moderna, and Novavax arriving over the next few months. Why did you decide to get immunized with the Chinese vaccine?
Well, when the opportunity is presented, we always grab the opportunity. That's the first. The second is that I think a lot of people get mistaken with the clinical trials, comparing apples and oranges. You have to remember that majority of the clinical trials were done at different points in time. And so the data that comes out of the Western vaccines may not be the same data as those that started later on in the clinical trials, like Novavax and Johnson & Johnson, where they have evidence also of data from the variants. Because by the time they started including patients in their clinical trials, they were already recruiting patients with variant strains.
And Doctor, before the AstraZeneca vaccines arrived, from the COVAX facility of the World Health Organization arrived last night, there have been some views coming out from OTCA research fellow Father Nicanor Austriaco that this South Africa variant dramatically decreases the AstraZeneca vaccine's efficacy from 70% to a mere 10%. Do you agree or disagree with the priest's statement on this?
Well, I will That is the opinion of Father Nick, but I think it's being based on one study. So I will agree with him when he says that based on that study, I think it's taken out of proportion, no? Based on a study done in South Africa, particularly in the university there, they were able to demonstrate that the variant, because about 90% of the SARS-CoV-2 variant, the South Africa variant that's circulating in South Africa is an escape variant. And when you say it's an escape variant, it means that the immune response to it is much poorer. Okay, so they were able to demonstrate that the vaccine's efficacy is actually much lower than you would expect with the 50%. But that is one study, and so they're still trying to collect more data to see if other variants. Well, we know that the UK variant, the AstraZeneca vaccine, will work against the UK variant, albeit it will drop the vaccine efficacy from 95.2 down to 85.6%. So with that in mind, you may expect the same thing also with the South Africa variant. And I think one of the things that we want to consider also is maybe we should put a little stricter policy on our borders, because we're not going to get variant strains that are from foreign countries if we're not a little too lax with allowing foreigners and overseas Filipino workers in very readily.
Thank you so much for your insights on this issue. Dr. Benjamin Ko, an infectious disease specialist from UST Hospital.